of Confident Parenting. We've been bringing you great content every Monday evening throughout the summer, and I hope some of you will join us now for Dr. Marianna Evans. We've been building up the anticipation for her, and here she comes. Third time's a charm. She'll be with us here in just a second. Hopefully she'll get in. Okay, here we go. We just wanted to build up a lot of anticipation for you.
Thank you so much for having me tonight. This is my first time going on Instagram Live.
No problem. I'm honored to be the first one to bring you on here. And I totally understand getting pulled away for the baby. We are all moms and parents, so we understand. It was like a big drum roll to get you here. Thank you so much for making the time. So let me introduce you, and I'm sure people will start rejoining in a few minutes. So this is Dr. Marianna Evans. She's an orthodontist, periodontist, and dental implant surgeon, and she specializes in orthopedic palatal expansion in children and adults and the diagnosis and management of jaw deficiencies in patients with sleep apnea and sleep disordered breathing. Whew, I had to read that to make sure I didn't mess it up. Dr. Evans has a very long list of certifications and accolades and publications that she's appeared in. It's too long for me to list here, but suffice it to say that I'm really honored that you took the time to join us tonight. Also, caveat, my son sees her for orthodontics, so we also happen to know each other, and we're having great results. So thank you again. Welcome, Dr. Evans.
Thank you again for having me tonight.
Yeah, great to have you here. So, I was saying to everybody in the last live, as a sleep coach, obviously when parents come to us for support, we are looking at it from a behavioral point of view. We're making sure that the timing of sleep is right and the environment and the routine. Is there something causing a problem? But sometimes we get all that lined up and parents are doing everything right and they still have a really restless sleeper. And I've been really fascinated to learn actually from my own dentist, who you're friends with as well, and just through my studies that sleep disordered breathing can impact kids really early on, and it can be a very subtle thing to notice. So I just wanted to have you on to, first of all, just explain in words that tired parents can understand, parents with really none of the accolades that you have. Why is the airway so important? What happens within the body when something is obstructed and we end up breathing, for example, through our mouth rather than through our nose? Because I think this is pretty fascinating.
Mm-hmm. So as of today, everyone knows that a condition called sleep apnea, or in other words, it's airway obstruction during sleep, where you basically are not able to get proper airflow through the airway and you stop breathing. So most people think that this problem only can happen to adults, but this is actually something that can also happen in children. And more and more research is coming out suggesting that there is a very significant link between facial development and your predisposition to airway obstruction during sleep, and even in some patients during the day. Mm-hmm. And this problem starts in children. So if you have sleep apnea as adult, most likely the problem, structural problem, started in a young age. So we as orthodontists try to diagnose this problem early in young children. And I usually see children under the age of 6, 5, 4-year-olds when they still have full set of baby teeth. And as you said, you are looking for behavioral component of the problem of the sleep. I think in young children, before you even see any type of obvious obstruction, like you don't always take x-rays on a young child that present with sleep disorder, but behavioral component is a very big one in terms of screening children for possible airway obstruction, but also structurally we evaluate children for proper facial development. So we look at the way the face is growing, we look at the posture of the tongue. Is the child breathing through the mouth, keeping the mouth open during sleep and also during the day? And in a lot of situations, you can even see a structural problem by looking the way the teeth are growing. If the teeth are crowded, if the child has an open bite, any type of cross bite, very high and narrow palate, a lot of these structural indicators will also suggest that the child might have deficiency in airway development and will be predisposed to mouth breathing, to compromised breathing during sleep, and also compromised breathing through the nose during the day.
Excellent. Got it. Got it. And so just to clarify for parents, when we're talking about the airway, there could be a problem with the tongue, where it rests and how it sits, or with the size of the palate, or even just the shape of the palate. From my understanding, over time, we're getting a lot more narrow, not so wide. And the jaw, the formation of the jaw. So there's lots of, I guess, elements to be looked at when there is an airway issue. And is it fair to say that this is something fairly specialized, that like the technology that you use to really look inside is more specialized than maybe just the average pediatric dentist or pediatrician would have access to or would know to look for? I think that's what happens, is a lot of parents talk to their main caregivers that they're noisy breathers or whatever, and they just say like everything looks fine. So what is it that you're using, and how specialized is that?
So I, as an orthodontist, I also specialize in facial and oral development. So today we have the technology, like if you go to the developmental endocrinologist, if your child's body is not growing or the child doesn't grow properly, like correctly in height, usually those children will get a growth hormone to enhance the body growth. So we basically are specialists in facial development. So just like endocrinologist is checking the growth hormone, we are looking at the facial development. Is the face growing correctly? And in particular, the upper jaw, because the upper jaw is the most moldable structure of your face in young children, and also now we have technology to change it and improve it in adults. The lower jaw problem is usually more genetic, and we are more limited how much we can grow the lower jaw, but not the upper. And the upper jaw is the center of your face. It's part of your airway, it's part of your nasal anatomy. The roof of the mouth is the floor of your nose, and also is part of the oral cavity. The palate, which is part of the upper jaw or the midfacial, the center of your face, is very critical, because if the palate is not growing correctly, and today the research is showing that if the child is bottle fed, is not breastfed at least 12 months, the first 12 months of life, usually these children will not have proper palatal and upper jaw development. Then if you introduce soft diet, if you introduce pacifier, any type of digit habit like thumb sucking, this also will affect upper jaw growth. If children start eating soft food and are not really eating enough hard food, like hard bread, hard meat, raw vegetables, the jaw doesn't grow. So that palate is also the floor of your nose. So if the palate is growing constricted, and this is why so many children today need palatal expansion, need orthodontic treatment, because if the bone is too small, the teeth grow crowded. The nasal cavity also doesn't develop properly in width. So the narrower nasal cavity, the more susceptible the child is going to be to congestion. If they have or developed any type of seasonal allergies, when they get sick, they have more difficult time breathing through the nose, during the day and at night, especially at
And
night.
then to compensate, they're going to open their mouth.
And in order for them to breathe, if they can't breathe through their nose, they have to breathe through their mouth. So once you start breathing through your mouth, and imagine you have flu and you are congested, how difficult it is for you to sleep and breathe and function because your nose is congested. So imagine a little child that cannot communicate to us that they cannot breathe through the nose because they don't know any difference because they have chronic allergies. A lot of these young children that develop the allergies develop inflammation in the nose, that inflammation can persist for months. So they will not be able to communicate to you that they cannot breathe through their nose, but they will keep the mouth open during the day and at night. And when you breathe through your mouth, your tongue is automatically displaced on your lower jaw. And the palate will be constricted by the cheek muscles or the side muscles of your face, which are very strong muscles, and it's not going to grow. So it's like a vicious cycle that is going to develop.
Right. Well, and the air, our nose has special filters, right? That our mouth
So
doesn't
the air
have.
is heated, is lubricated, and is also filtered if you breathe through your nose. There is a reason why we have a nose.
Right.
So if you don't breathe through your nose, especially on regular basis, like chronically mouth breathe, you are going to be more susceptible to ear, nose, throat infections. You will actually have special tissue overgrow inside your nose to obstruct it even more. And in the back of your throat, you will have enlarged adenoids. The tonsils will have to be basically filtering all the air that goes through the mouth. So the tonsils will also obstruct your airway. Little children have smaller airway dimensions, so it doesn't take much inflammation to obstruct the airway. So I think from my standpoint, every child that is not breathing, that is not sleeping very well, should automatically be screened for any type of airway obstruction. Because when you think globally, the most common problem that children have today is nasal congestion because of the allergies. And in a lot of children, this problem starts with allergies. So I always take special x-ray to screen for enlarged adenoids, tonsils, nasal anatomy. When the palate is not growing correctly, most of the time is constricted because the tongue is being displaced down. Then you often will also have deviated septum that comes along with narrow nasal passages that develop as part of the narrow palate. So it's kind of one system. You cannot separate, in other words, you cannot separate the nose from the mouth because the palate is covering both areas.
Right. And I think it's really important for parents to understand that we're not just talking about how their teeth are going to cosmetically look when they're older. You're talking about the palate, sometimes cosmetically, but under this situation that we're talking about, it's more of just having the capacity, not such a narrow space to breathe through, which I don't think a lot of parents realize that the palate can impact things so early on. Well, that was really helpful. Thank you. So in terms of red flags then that parents can be looking for, you already mentioned if they have a restless sleeper in your mind, that would automatically be something to check out. And, to define restless sleep, I would say it's just a child who wakes very, very frequently, more frequently than is appropriate for their age, which varies depending on the age. Would you also say, do kids that this is happening to, they tend to wake up with alarm and upset because they are almost waking up to take a breath? They feel like they can't catch the breath.
So some children will be gasping for air and will be waking up. Basically, if your oxygen level drops significantly because you have hypoxia or you have apnea or hypopnea, when you basically don't get enough air through your air passages, what will happen? The child will wake up in the middle of the night. And a lot of these children And adults will wake up multiple times throughout night. The child should be sleeping throughout the whole night from the time they fall asleep until 7-8 hours later, based on the age too. Like younger children should be sleeping 10 to 11 hours per night. So restless sleep, bedwetting.
Bedwetting. I was going to mention that. And
Loud,
can
heavy.
you explain that connection? Why the airway issue would trigger the bedwetting?
So usually during sleep, your body is resting and regenerating. All part of your body, all systems are going to regenerate and basically get ready for the next day. So if you are not breathing like passively or easily through your nose, through your airway, like behind your tongue is your throat. So usually we look at those anatomic structures for any type of obstruction or collapse of the airway in that area. And what will happen is your body may have to work to keep that airway open. So instead of having restful sleep, you are going to work to keep the airway open. So your heart is going to beat much, the heart rate is going to be increased. Your sympathetic nervous system is going to work harder. And when that happens, it's going to trigger bedwetting and urination. So when you
sweating, is that why sweating is often listed as a red flag?
sweating,
Working
the
so
same
hard.
with sweating, the same with tooth grinding. If the child is has a very significant bruxing or tooth grinding at night that persists, you have to screen for sleep disorder, for airflow. Basically compromised airflow through the or airway resistance, we call, through nasal passages and through the throat. Then these children will be moving a lot, like they will be tossing in bed. When you walk in the room, you will see that they are upside down or the blanket is on the floor. The child should be completely peaceful and sleeping like a baby, like we say.
That's where that phrase comes from, right?
If the child is sleeping with the open mouth, sweat, as you said, sweating and snoring, of course, is a red flag. So these are behavioral component of the sleep disorder.
And mouth breathing can be quiet. So snoring is one version, but they could be breathing through their mouth and you aren't hearing any snoring. Is that correct?
Yes, if they breathe through the mouth, they could or could not be snoring, either way. But what will happen is a child will be sleeping maybe 50% of the 24 hours, right, of the day. So during 50% of the time, if your mouth is open, your face is automatically is not going to grow correctly. So the faces usually grow longer, narrower, and the teeth will be growing more crowded as you continue to sleep with your open mouth.
Right.
Plus, as you were saying earlier, that the air quality that you are getting to your body is going to be, you will get less oxygen to your body, and the air is not going to be filtered properly if you inhale
and then,
it.
of course, children may have focus, attention, behavior issues during the
day.
The quality of their sleep and their air is so poor.
So during the day, you will be looking for, usually adults, if they don't get enough sleep or if they have sleep apnea, because sleep deprived could be insomnia as well. So if you don't get enough sleep as adult, usually you are sleepy and you will have hypersomnia during the day. If a child doesn't get enough sleep, then a lot of times they will be very hyperactive during the day. It will affect their attention in school. They will be very irritable, crying a lot, and they will have a very difficult time concentrating. So it will be kind of the opposite effect as we see in adults, what we see in children. So these are
That's really
behavioral.
important for parents to know, because they might say, no, he had so much energy. He never stops. He's never still, but it could be hyperactivity.
Mm-hmm. So a lot of children that are diagnosed with ADHD, I think before this diagnosis is made, have to be screened for sleep disorder breathing or any type of airway obstruction during the day and during sleep. And I think this problem has to be solved before these children are placed on the medication for ADHD.
Yes, I don't remember the number, but I remember reading recently that there's a high percentage of misdiagnosis as ADD or ADHD, but it's actually a sleep disorder.
Mm-hmm. And the younger the child is going to be that develops the sleep disorder breathing and it's not addressed, it's going to affect the cognitive development long term. So it will affect performance at school and IQ long term.
Okay, great. So just to recap, snoring or mouth breathing without snoring, bedwetting, persistent tooth grinding, restless sleep, and maybe behavior hyperactivity issues the following day would be red flags to look for. So did I miss anything on that list? That was good.
They could have acid reflux.
Oh, yes. Thank you. And what is that because the air is not filtered? What is the connection there?
There is a mechanism that basically a lot of when there is an obstruction of the airway, sometimes the acids of your stomachs are going to be, it depends how the muscles contract, will be carried all the way up into your upper airway. The mouth. So this is very common for a patient, adult and child with acid reflux to actually have upper airway obstruction.
So the reflux would come first, and then the airway issue would result from that. Or it can go both ways.
Still not fully studied, but one of the theories is that the contraction of some muscles is going to cause acid reflux. Acid reflux is an outcome of the sleep disordered breathing.
Excellent. Okay. I don't even know if I knew that one, so that was helpful for me. Okay, great. So we know why the airway is important, why nose breathing is better than mouth breathing, and we have our red flags. If a parent is seeing one or several of those red flags, where should they start in finding somebody? Obviously, we have you're in Newtown Square, you're in Glen Mills, everyone can come find you there. But for families that aren't local, how would they find someone within this specialty that can really help them sort this out?
So as an orthodontist, I usually treat structural component of the airway obstruction as well as facial development. So I help children and adults to develop the midfacial structure, which is the upper jaw, to the right dimension in width and also bringing it forward. This also, to some extent, is going to help the growth of the lower jaw and development of the teeth. So this is a structural component of sleep apnea and airway disorder. There is also an obstruction or soft tissue component of this problem. So usually we look on the X-ray, and if you go and see ENT, they have special scope that they can evaluate soft tissue obstruction of the upper airway by adenoidal tissue and tonsils. So we usually work together in team with ear, nose, throat specialists that will identify soft tissue obstruction and eliminate it surgically.
So an ENT referral could be a good place to
ENT
start.
referral is very critical because the ENT will diagnose if there is a problem in the airflow through nasal passages. Is there anatomically an issue that they can address? Like in older kids and adults, they will do septoplasty, or they can do turbinate reduction when the turbinates are very large. They will look for, mainly in younger children, adenoidal enlargement and tonsillar tissue obstruction. And when you see it, usually they will treat it surgically. Now there are some non-surgical protocols where they can prescribe special medication to shrink adenoidal and tonsillar tissue. And I think for many children, those protocols are very effective. Moderate and mild obstruction. And of course, you also want to get to the root cause of the problem. So if it is structural, your orthodontist can help with the problem. But if it is inflammation related, and we are talking about allergies, which is the most common cause of any type of airway obstruction, then you have to involve allergy specialists. And today, a lot of our children eat too much sugar and eat the diet that is going to predispose them to inflammation. So I think nutrition is very critical, and also it's very important to see, to screen these children for allergies to any type of pollen, chemical, dust, and these allergies can be treated with special allergy shots, or also with other like oral medications or nasal sprays to help these children breathe through the nose.
Okay, wonderful. So as with a lot of issues with our kiddos, it's going to be a multidisciplinary approach to making sure it's nothing soft tissue, nothing with allergies. You would help with the actual structure. So parents may be in for seeing more than one specialist to get to the root of it. I guess the last thing I wanted to ask.
Well, I wanted to add one more component.
Yeah, go ahead. Sorry.
So it could be also functional component of the problem. Many children today present with condition called tongue tie, lip tie, or ankyloglossia for the tongue tie. This is basically oral soft tissue restrictions that prevent proper rest of the tongue on the palate. Usually, tongue tie is diagnosed in infants, in newborns, when mom has difficulty nursing the baby, when baby cannot latch. However, as an orthodontist, I see a lot of older children, and I also see a lot of adults with ankyloglossia on tongue tie that was never addressed. And in older children, parents, and in many situations, pediatricians think that the tongue tie is mainly going to affect nursing and speech. Today, more and more research coming out that the tongue tie may predispose children to choking, like on multiple occasions, not just like one time. And I have seen many children with tongue tie that have history of choking several times, serious emergency in children. Then it's also going to affect their facial development, and especially palatal development, because if the tongue is tied, there is a special membrane under the tongue that connects it superficially to the lower jaw, and also in deep inside there is a muscle that connects the tongue to the lower jaw. So when that muscle is too short, or that membrane is too short, what will happen is that the tongue is going to rest on your lower jaw, and the upper jaw is not going to grow, because physiologically speaking, the tongue is making the upper jaw grow in width and forward with breastfeeding, and then with rest position and during chewing. So if you swallow and your tongue doesn't sit on the palate, doesn't put pressure on the palate, if the baby is nursing and the tongue is not putting pressure on the palate is not going to grow. In a lot of children, open mouth posture does not always equal mouth breathing. So you will find some patients will be nose breathing, but they keep their mouth open because the tongue is positioned low because of the habit. In many children, this habit develops because of the pacifier use. in infants and also like beyond 6 to 12 months of life. So when the tongue is restricted, the palate is not going to grow. So what we do, we release the tongue. It's a very minor procedure, and we usually do it with laser to allow the tongue to stretch and rest properly on the palate. But this procedure has to come along with physical therapy of the mouth, where you retrain the tongue to rest on the palate, and you retrain all the muscles of your face, lower face, like lips, tongue, and cheeks, to properly function. Because if the tongue
because we overcompensate, right? We'll find a way to do it.
tongue is restricted, basically you have to overuse your lip and cheek muscles to accomplish the same function that is usually done with free tongue. So a lot of these children will require physical or myofunctional therapy of the mouth and release of the tongue tie to allow the tongue to rest on the palate and the palate to continue to grow.
So if a pediatrician, I'm so glad you mentioned this because I forgot about the tongue tie aspect. If a pediatrician says your baby's eating well, so I don't think you need to revise the tongue tie, in your opinion, you would probably like to see that revised anyway because of all the additional issues it can cause.
I would probably consider, of course, if the baby is latching, if the mom has very comfortable nursing experience and the baby is gaining weight, I think not every tongue tie has to be released.
Okay.
But you have to monitor these children for facial development. And if you have a child that has the tongue tie and has a underdeveloped lower jaw or some kind of facial development, other facial development issues, I think it's important to release it, not only just for nursing, but for improving further proper development of the upper jaw and also the face.
Okay.
And
for parents that are choosing to use pacifiers and such, if it were up to you, when would we all stop using them for optimal jaw development?
So first of all, I always tell the parents that the pacifier is not for the baby. The baby is born, does not know what the pacifier is. It's for the parent.
It's for us.
So if you can avoid it from the very beginning, that's the key. Okay. There are other ways to soothe the baby and to achieve the same things that we achieve with pacifier.
Sure.
But if you already introduced it, I think you have to stop using pacifier by 6 months.
Okay, because I've heard everyone looks at it through a different filter, right? Lots of different opinions. But this is an important aspect, so it's good to know.
This is one of the main things that is causing dysfunction of the muscles of your mouth, and especially in of the tongue, and is going to affect facial development throughout growth of the child.
Okay, excellent. So just for parents who might be hearing this and saying, oh no, I think I need to have a screening done for my kiddo. Correct me if I'm wrong, but improving the palate is a fairly simple, not scary process, right? Can you just let parents know like what that involves and what that looks like?
Yes. So today we have technology where we can change the shape of the palate. Not only in children, we can change it even in adults without surgery, especially adult females of any age. So everyone today whose child underwent orthodontic treatment, or even adults today that underwent orthodontic treatment as children, probably heard of palatal expansion or maxillary expansion. So this is a special device that we install on the palate that we gradually use to stretch the palate. So
almost like a retainer. Most adults are familiar with a retainer.
Yes, so it's like a retainer, but there are different kinds of expanders. There are expanders that rest on the teeth and are removable like retainers, and there are expanders that are glued to the teeth, or there are even expanders that have no attachment to the teeth but are held permanently in the mouth for the time that you need to go through expansion with little anchors, or like temporary implants that we call. So the technology of expansion has significantly evolved over the past 15 years, and we can customly design appliance utilizing teeth as anchors and also those mini implants as anchors based on the patient's age and the patient's anatomy. And this is probably the least invasive procedure that we can offer in terms of changing the shape and the size of the bone.
And I can attest to that because I have a very dramatic 11-year-old boy. And we have undergone your palatal expansion with no drama whatsoever.
So we see a lot of children, even with special needs, that are able to tolerate it. So the expanders are getting more comfortable. The technology is improving. Even like in a few years, I expect this to be even more comfortable procedure. Of course, the best option that you can have is no expansion. If your child's jaw grows naturally,
Right.
forward enough, that's the best thing that can happen. But with the way our diets have changed over the past 200 years and environments have changed, I think the palatal expansion will be more and more commonly done on children.
Most of us aren't going to have just the natural nice growth. Well, and just the night and day, I mean, I guess lastly, can you speak to the difference that patients notice when the palate is expanded in that non-invasive way? What type of differences are adults and children seeing in their health and their sleep?
So most of the time we see the change in airflow through the nose within 30 days of expansion. This is a very important information that is reported by adult patients that are undergoing today a non-surgical expansion, because they are more vocal, they can explain the difference. With children, it's a little bit more difficult to get the feedback what they are feeling. But I personally underwent non-surgical expansion for myself a year and a half ago, and I, even till today, am surprised how much better I can breathe through the nose. So you feel like you are less congested. You feel like you can run much easier without like the need to open your mouth when you run. That the air flows through the nose is much easier, and you feel like you have more room in your mouth for your tongue, that your tongue fits a little bit better, because obviously we don't want to expand somebody that has normal development of the palate. We only expand people that have small palate or small mouth. So a lot of these patients, they complain, they feel like the tongue is choking them, that the tongue doesn't have room in the mouth. So once you expand the palate, that feeling of freedom for the tongue to rest on the palate is very common in adults and in some children that are very expressive and feel the difference. And of course, the most common finding is that patients report that they sleep better. Some of them will report that they are not snoring after expansion, and many of them will say that they have more restful sleep.
Which would then help the mood and the attention and focus the next day.
Those patients that sleep with their mouth open start sleeping with the mouth closed after expansion. But some patients, open mouth during sleep is also a chronic habit that persisted for years. So sometimes you actually have to use little tape, and there are many available today over the counter to safely, basically gently seal your lips, to retrain your lips to be closed during sleep. Because today you can control yourself, but you can't control yourself during sleep. So there are a lot of patients that say that, oh, my child is now sleeping with the mouth closed, and their sleep is, they are very like calm when they sleep, or like they are not breathing loud during sleep. But in some situations, you still, this change is temporary. in patients with allergies, because first, when you open the palate, you open nasal passages so you can breathe freely. But if the inflammation because of allergies persists, the new inflammatory tissue will refill the new like open space that you create.
Mm-hmm.
So I think it's very critical to diagnose not only that the patient has narrow palate, but if they do have those allergies that cause inflammation in your nose, you have to treat the allergies, because that's the root cause of your breathing disorder. So it's very important to kind of see multiple specialists and treat it as a multifactorial problem.
Excellent, excellent. Well, I found this fascinating. I hope everybody else did too. I know a lot of our parents are tucking their kiddos in, and they'll probably watch this later when I post it on the page. So lastly, let me just remind everybody where they can find you. So Dr. Evans is at Infinity Dental Specialist in Newtown Square and Glen Mills with her colleagues and her team. And like you mentioned, if they can't find you, they can go find their local ENT who can probably connect them with someone who is similarly specialized. I am so grateful for you taking the time to share this with us tonight, and I hope to share this with many more families who may need to hear this information. And coincidentally, we'll be coming to your office tomorrow morning. So I'll see you tonight, and I will see you then. And thank you so much. I hope to have you back again sometime in the future.
And thank you so much for having me, and thank you for raising awareness about this problem, because every child that cannot sleep well should be screened for anatomic component of the problem, and also for any type of airway obstruction. So thank you so much for looking at this problem in a comprehensive.
Thank you. Thank you for helping us raise awareness. All right, get back to your baby and have a good rest of your night. And thanks to everybody that watched. Bye-bye.